Public health emergency management preparedness and capacity building. Outlines. Introduction to public health emergency preparedness. Introduction to vulnerability assessment and risk mapping. Capacity building, monitoring and evaluation. At the end of this session, participants will understand and familiarize with activities undertaken under preparedness and capacity building. Introduction to public health emergency preparedness. The range of deliberate critical tasks and activities necessary to build, sustain, and improve the operational capability to prevent, protect against, respond to, and recover from accidents. Preparedness activities and tasks are those things that should be done prior to the occurrence of emergency. Being prepared to detect and respond to such an event is an essential role of the district. To strengthen aim of preparedness, to strengthen capacity in recognizing and responding to public health emergency through conducting regular risk identification and analysis, establishing partnership and collaboration and strategic communication during the pre-emergency phase and ensuring their monitoring and evaluation. Main objectives: prevent avoidable crises and catastrophes, reduce morbidity and mortality effects, avail resources, minimize disruption to health service. Vulnerability assessment and risk mapping. Vulnerability hazard risk. Vulnerability assessment risk mapping. Hazard is any dangerous situation or phenomenon which has a potential to cause damage, loss or injury to human property or environment. Classified as depending on origin, onset, depending on speed, depending on origin or origins onset, geological, hydrometeorological, biological, socio-economic, technological is human. Hydrometeorological is natural. Depending on speed, rapid, slow. Vulnerability is the characteristic and circumstance of a community system or asset that make it susceptible to the damaging effect of a hazard. Describes two aspects of the subject: susceptibility, and resilience. Vulnerabilities: pre-existing condition much more determined by human behavior than hazards. Varies across geographic space and among and within social groups. Scale dependent, individual, household, region, country, etc. Dynamic or change over time. Nearly all concept of vulnerability view it as an intrinsic characteristic of a system or element at risk. Can be applied to communities, social groups, structure, physical structure, ecosystem, etc. Vulnerability assessment and risk mapping. One of the pre-emergency activities of preparedness. A vulnerability assessment is a continuing dynamic process of assessing hazards and risks that threaten the population and the health system and determining what can be done about it. Done periodically to predict and be prepared to mitigate the problem which come as a result of them. A vulnerability assessment provides a means to inform decision maker about the need of preparedness at different levels. A starting point to construct an overall plan that corresponds to the dimensions of identified risks. A tool to initiate is a public health emergency preparedness planning. Can also help to measure the level of preparedness or unpreparedness. Risk. Risk is defined as a product of the likelihood of the occurrence of a given hazard, epidemic disease, drought, flood, etc., and the vulnerability to the impact. Disaster risk. Potential disaster. Potential disaster. Potential disaster loses vulnerability assessment and risk mapping. Vulnerability assessment provide a means to inform decision makers about the needs of preparedness at different levels, a starting point to construct an overall plan that corresponds to the dimension of identified risks. A tool to initiate the public health emergency preparedness planning can also help to measure the level of preparedness or unpreparedness. Risk is defined as a product of the likelihood of the occurrence of a given hazard. That means epidemic disease, drought, flood, etc., and the vulnerability to the impact. Disaster risk. Potential disaster losses in life, health status, livelihoods, assets, and service, which could all occur to a particular community or a society over some specified future time period. Disaster. A serious disruption of the functioning of a community or society involving widespread human, material, economic, environmental losses and impacts which exceed the ability of the affected community or society to cope using its own resources. Disaster risk assessment. A methodology to determine the nature and extent of risk by analyzing potential hazards and evaluation existing conditions of vulnerability that together could potentially harm exposed people, property, service, livelihoods, and environment on which they depend. Risk analysis is the process of computing the level of risk by bringing together the various attributes that contribute to the reduction or amplification of risk from a given hazard to individuals and communities. Risk mapping of exposure and vulnerability, including the physical, social, health, economic, and environmental dimensions, and the evaluation of the effectiveness, prevailing and alternative coping capacities in respect to likely risk scenarios. 3. Preparing an epidemic preparedness and response plan. Risk reduction. EPRP, an emergency preparedness and response plan, is a document that describes how an organization will manage its preparedness and response to risk and emergencies of various types. A national or regional health emergency preparedness and response plan describes how the health sector structure and organizes itself for the management of an emergency response. An efficient preparedness system helps to effectively anticipate, respond to, and start to recover from the impact of likely imminent or current hazard events or conditions. EPRP is one of the components of the pre-disaster or prevention, mitigation, and preparedness phase and an essential component of preparedness. The EPRP should have a multi-hazard approach to guide and define response for both public and public health events involving infectious and non-infectious hazards and for the health consequence of any emergency or disaster. The EPRP should present the roles, responsibilities, systems, and mechanisms for emergency response within the health sector, but also towards the other sector and competent authorities. EPRP should define each level of PHEM emergency preparedness level required for institutional readiness, as well as the projection to reach or maintain it, the mechanism to detect and investigate an alert, and to activate an appropriate response in a timely manner, the structure and the mechanism to effectively coordinate and manage a response. The response strategy and required resource for efficient response to specific risks identified in the country. The maintenance of routine health services during an emergency response and the plan for recovery and provision for building back better. Enabling factors for developing an EPRP. Political commitment, inventory of existing plan, regulation and legislation in the area of emergency response, all hazard risk profiling and prioritization, capacity assessment, or including human resource, infrastructure, logistics, etc. Monitoring and evaluation of PHEM preparedness indicators, coordination and collaboration, number of coordination forum activity response, number of coordinated response given to health emergencies, vulnerability assessment risk mapping, list of hot spot areas identified by type of hazard, vulnerable group identified by type of hazard, planning, preparedness plan available, capacity building, proportion of zones, whereas with PHEM structure, number of need-based training conducted, proportion of zone and whereas with an available stockpile to cover at least 1 month at lower level. Thank you.